FORA.tv. The world is thinking.
Jeff, can I add something in defense of those poor old blue dogs who are sweating it out right now? What they're deeply afraid of is getting BTU'd. Anybody remember that? I got BTU'd. I know about it. BTU'd is a symbol now in Washington for having to vote for something in the House that's hard for you to defend at home, and it gets fixed in the Senate, which you've already cast a vote. It's hard to defend back in your home district. And they have the notion that the Baucus committee is probably going to come up with a compromise on some of the elements they're concerned about, pay-fors and size of the bill and public plan, a number of issues. And they will have already voted for the Waxman bill that's harder for them to defend at home in their districts. So they legitimately are saying, if you're going to make those changes in the Senate, why don't you make them in the House so we can vote for them now rather than having a bad vote on our resume when we go back home. That's a legitimate concern, and that's one I think that the leadership in the House and the President are wrestling with.
Well, I think there's a second.
Go ahead, Tom.
I was just going to say there's a second concern that I'm fully supportive of as well, that the Blue Dogs, to their credit, have put their focus on, and that's cost containment.
That's right.
You know, Elmendorf and the CBO has made it quite clear that we're not succeeding in our effort to substantially bend that curve that everybody proclaims an interest in doing. And, you know, and I think we can do a better job, and I think it's going to take more meaningful public policy approaches to do that, and we can get into that discussion if anybody wants. But the Blue Dogs, as I say to their credit, have put a real focus on that as well. We've got to do that. We will not have succeeded if we haven't bent the cost curve effectively. And the jury's still out on whether we're going to get that done or not.
If the cost curve can be bent, how much does that mitigate against and you're talking about the cost of health care, not the cost of the plan, correct? How much does that mitigate against the fears of an explosion of the deficit in paying for the plan? Do you then offset that expense?
Well, to a certain extent, but keep in mind, you know, the next 10 years, the United States is going to spend approximately $35 trillion on health care. $35 trillion in the next 10 years. And just to keep that in perspective, as you look at what the government, what the House and Senate are trying to do to pay for the initial 10 years of new infrastructure so that we can bend the cost curve in the out years, and they're looking at $1 trillion to maybe $1.2 trillion. So when you look at the fact that it's 1/35 of the overall amount, and keep in mind that, you know, there are only three ways to pay for all of health care. There's the government through taxes. There is all of what happens in the private sector through insurance and everything else, and then there's out-of-pocket expense. But when we look at the global cost, whether it's a little bit more government or a little bit more out-of-pocket or a little bit more insurance-driven, that isn't as relevant as what we do to that overall global amount that we're committing to in the next 10 years. So I think we have to keep that in perspective. But there's no reason why we can't come up with a $1.2 trillion offset for what we have to do to put that infrastructure in place. Is it painful? Of course. But there's revenue, there are cuts, and there are certain modernization approaches that can bring down costs. But those are the only three buckets to come up with that $1.2 trillion. How much in revenue, how much in cuts, and how much can we squeeze out in modernization? And that's really what they're trying to do right now. None of them are easy.